Your doctor has ordered the Doctor's Data Salivary Hormone Specimen Collection Kit. You'll see the contents of the kit outlined here on the table. First, what we'll do is just discuss here briefly the test requisition. This is the physician's information. This might be filled out prior to you receiving this kit, but it is okay if it is not. This will not prevent the test from being completed. This test kit you will pay at the time of service, so you will notice that it will we'll make sure to mark that physician account is what we will bill this to, because we charged you here at the office. We are ordering the adrenal function profile, which is this one selected here. And you'll notice there are some highlighted portions which you will be in charge of. Your test requisition may or may not be highlighted, so make sure that you complete these components, even though on your test requisition they may not be highlighted. There is collection information here where you will put the date and the time that you collect all of your specimen. The women only section, obviously for females, making sure that you indicate what your menstruation status is, and then noting here that it was frozen, which I will discuss, and then the date that it was shipped. This is all your patient information here, so making sure with nice legible handwriting you indicate what your name, your date of birth, your address is, as well as your phone number, and then you'll sign and date here at the bottom of this section. This will be billed to physician's credit card, so you do not need to put any of your payment information in this box here. We do not charge insurance, so we have marked out this box here. That is everything that needs to be completed, so really only paying attention to boxes 3 and 4 for you to complete. You also see there is a patient survey that the company likes just to have some additional information, and they provide this back to us once they release the results, so you're welcome to fill this out. You do not have to, however. In order to prepare for this test, there are some specific kind of preparation things, but it doesn't have to be, too advanced here. We have some just kind of notes here that it's really just day of collection is when you have to do the most here. You will notice that it does mention do not take any supplements until after you have collected all 4 samples. This is not necessarily a true case for you. If you are on supplements that either support your adrenal functioning, are an adrenal glandular, then definitely, yes, avoid those the day of testing. But any other supplements, unless indicated by your provider, you are welcome to continue. So really only avoiding the adrenal support supplements, as well as those supplements that have the adrenal glandular product in. If you are unsure if you're on those products, please reach out to your provider. There are some additional information as far as kind of especially the first salivary collection here. The first one must be done 30 minutes after you wake up. Make sure that you set a timer, because that timing is very crucial to make sure that we get a nice reliable result here. Do not eat or drink anything 1 hour prior to collecting your saliva collection. This is because this can contaminate the sample with any sort of food product, and we don't want that to happen, because we don't want you to have to recollect that. And another important thing that will help to prevent any sort of contamination with blood or plaque, for example, is to make sure that you have not brushed or flossed or even seen a dentist within the 30 minutes prior to collecting your saliva collection. This is true for each of those collections here, which we'll review in just a moment. So just not only just the morning or the evening one. Making sure that you're avoiding any food or drinks that contain caffeine, including teas. So this will be likely done on a day that you don't have much to do, so that you can make sure that it's, you don't need that caffeine as an extra boost. Caffeine will falsely elevate that stress hormone cortisol and give us inaccurate results. And we want to make sure that this test gives us nice, accurate results so that we can treat you appropriately and get you feeling better. There is a note here to avoid all nuts, fruits, fruit juice, wine, rice, and coffee. Really, it's just the coffee that we care about from this list here, unless indicated by your provider. This test kit does test other hormones, but we are not testing that with this collection here. So this really only applies to a different test. So don't pay any mind to that, except obviously that coffee portion of things. Before each saliva collection, it indicates washing hands, making sure that things are clean. And then this section here is really for the other panels that this test kit will test, which we do not need to worry about. So you can use any sort of topical creams, anything like that. We have kind of what the saliva collection looks like here. I have labeled them, or just kind of set them in order of the labels here. So number 1 is this pink one, number 2 is this green, 3 is orange, and 4 is this lighter blue color. There's also these little straws that are included as well. So the very first collection, like you'll remember, will be 30 minutes after you wake up, making sure that you're fasting for at least 6 to 8 hours. You'll then put this straw directly into this tube and spit into this tube, okay? So we'll make sure that you get at least up to that 3/4 of the way mark. After you're done, you'll throw this little straw away and cap the tube just like that. If you're having some difficulty producing saliva, there are a couple tips that we've heard from our patients that are really helpful. Either thinking about your favorite food, smelling your favorite food, chewing, or even smelling pickle juice have been really, really helpful to train the brain or just kind of trick it into saying, hey, we need to produce some saliva because we think we're about to eat now. And that will help with some decent saliva production. These straws really do decrease the amount of air bubbles that can form when you're spitting. However, if you do notice that you're still having some air bubbles, either slam it down on the counter or even put it into the freezer for a few minutes will really just help to pop those air bubbles. So this is the first collection here that's completed. So then we'll go back to our test requisition. You'll make a note of the time that it was completed and select AM here, nice and clear. And then on this bag here, you'll do the same thing with the noting of what time it was done. You'll do the same thing for number 2 with this green one right before lunch, number 3 before dinner, and number 4 at the bedtime hour, discarding the straws with each collection. When you're done with each tube, placing it into the freezer so that we can have a nice frozen result at the end. Once all of these tubes are completed, you'll note with nice legible handwriting your first and last name as well as your date of birth, making sure that everything is nice and legible with those components there. And then we'll pretend like all of these are capped. They'll go into this bag here. Oops. In this bag, you will notice that there is a little piece of paper towel. This is to collect any sort of condensation that might appear and definitely collect any sort of saliva that might pop out, which is why it's so important that you make sure this is nice and capped tight before you put those little tubes into this baggie here. If we don't get a full sample sent to the lab, they do request that patients will have to recollect. So it's really important that you're doing such a fabulous job by making sure you're following all these instructions. But number 1 is to make sure that these caps are nice and sealed tight. You'll put this into the freezer at least overnight in order to allow for these tubes to freeze completely. If you overfill the tubes, really going over that 3/4 mark, up the tube, they will explode, and that will just make the specimen not viable. So important to follow those instructions there for sure. This ice pack here, either when you first get the kit or before you decide that you want to collect the saliva, put it into the freezer so that it's nice and frozen, so that this is the day that you do your collection, everything's put into the freezer. The following day, once everything is frozen solid, you'll take them both out. You'll place them into this box just like so, into the styrofoam there. All of these little straws will have been discarded. You'll make sure all of this collection information has been filled out, as well as your demographic information. You'll fold this up into the smaller pieces here, and then really the best option is to set this requisition either on the back side of this styrofoam box or on the top, because the condensation from the ice will cause the ink to run. You want to make sure that your information that you so wonderfully put on there is nice and legible. This survey here, if you decide to complete it, will go into this here. Not 100% needed, but is really helpful for sure. Put it in there just like that. So this is what the kit will look like when completely done. You'll close this box up just like so. And then you'll take your FedEx bag, open it up. You'll take off the sticker just like that, and then you'll fix it right onto the front of the FedEx bag. You're welcome to put your return address if you'd like. This is the address that this is going to. You'll then take this box and put this into the FedEx bag just like that. In order to seal, you'll take off this red adhesive tape here, making sure that once the box is in there, you kind of take out all the air out and press it to seal. You'll then contact FedEx for a pickup at your house, or take it to a FedEx station. We do not ship these from our office. We do require patients to have them shipped themselves. If you have any questions at all, please don't hesitate to reach out to the front office or your provider.